Meanwhile, a civil society group in Ghana is urging the government not to make vaccination of the coronavirus disease compulsory. The group is of the view that any attempt to force vaccines down the throat of the citizenry would be an abuse of their fundamental human rights. This comes as the government in recent weeks indicated that vaccination would be mandatory in order to access public services. Well, joining us to talk some more about this is Dr. Samuel Ofori-Agyekum. He's a medical practitioner. He joins us. Thank you for joining us on the program.
Thanks for having me.
Now, Ghana appears to have taken a firm stand about mandatory vaccinations, barring unvaccinated persons who will arrive the country effective 29th of December, I believe. How are people reacting to this?
Well, the reaction has been quite mixed, I must say. For those who are fundamentally in favor of vaccination, most of them do not have any problem at all with such an arrangement. But you know, as you noted quite a while ago, there are some people who believe that public health safety should not trump issues of personal liberty. So for those who feel they have the right not to be vaccinated, they have some reservations. But sometimes in case of such a pandemic, I guess the government has to take stringent measures to protect us all.
Give us an idea of how fast the Omicron variant is spreading in Ghana and, what government has been up to try to stem that spread.
To be sincere, not as fast, simply because the government was quite proactive in its containment measures. So initially, there were about 2 cases that were reported. It shot to about 32, but almost all these cases were imported cases. So when the government noticed, they started contact tracing immediately, putting people in isolation to make sure that there isn't much community spread of the Omicron variant. So as we speak, there haven't been so much of the Omicron variant cases reported yet, but the jury is still out. Maybe there's time. Over the course of time, we will see more of such cases being reported, hopefully.
So let's look at the mandatory vaccines which the government has imposed. Are people now racing to get vaccinated? Also, the Ghana service, I believe, said that it wants to also vaccinate children 15 years and above, and also all workers in schools, before the next academic year. Are there enough vaccines in the country to achieve the same?
Well, there aren't. We don't have enough at the moment, but I believe there are measures in place to bring in new vaccines. Because as of last week, there were new vaccines that came in, about 3 million doses or so. The government's plan is to be able to vaccinate about 20 million people. That brings us to roughly around 40 million doses of vaccines. Currently, we do not have that much, but I believe for the government to come out with such a program, they already have plans in place to procure much more vaccines to cover the population targets they are looking at.
What's your take on booster shots? Seeing as Africa, we don't even have enough vaccines available to the relevant population to achieve herd immunity.
Well, you see, the virus has been, behaving quite differently in Africa as compared to the other countries. But that still doesn't mean we should relax. So the vaccination is quite necessary. And even though, as you are saying, we do not have enough to reach herd immunity, we still must go ahead to reach the population size, the sizable amount of people that we can be able to reach, which I believe will help us in containing the disease, preventing much more deaths, and also preventing severity, because as you see, people can even be infected after vaccination, but then at least if they have been vaccinated, the severity and hospitalization significantly reduced.
So are you in favor of the booster shots, which some are defining as a 3rd dose?
Yes, I am in favor, but unfortunately, the Ghanaian government's policy as at the moment is not focused on booster doses, because the first target of the 20 million people being targeted for vaccination has not been achieved yet. But if we have enough doses, then obviously I am for booster doses being given.
All right, we'd like to appreciate your time. Thank you so much. Dr. Samuel Ofori-Agekum is a medical doctor in Ghana. Thanks for joining us.
Thanks for having me again.